Welcome back to the TastyBrains podcast. I'm your host, Paulie Donuts, with my special guest, Dr. Shaher Kahn. Dr. Kahn, we are live. Welcome.
Thank you very much. It's a pleasure to be here, Paul. A pleasure to join you and your audience, and hopefully they will find this informative.
I appreciate you, above all things, you have, carving out the time to come on my podcast. This topic is something that I think is just kind of out there for some people that are close to it. And if you're not close to it, you really have no clue about it. And the topic that we're going to be talking about today is B.I.I. It's, how do you what's the B.I.I. stand for?
So breast implant illness.
Perfect. And before we get started, hot and heavy into the topic, first, I'd like you to just kind of give your background real quick. I do a really bad job of just jumping into the topic and not letting anyone who's not watching know who I'm talking to or their credentials. So go ahead, Dr. Kahn.
Yes, please. So my name is Shaher Khan. I'm a board certified general surgeon. I'm also a board certified plastic surgeon by the American Society of Plastic Surgeons. So I have done 5 years of training as a general surgeon where, all aspects of general surgery I have done. And then I've done 2 years of burns, critical care training, and then 3 years of plastic surgery training, a total of 10 years after medical school. And so as a board certified plastic surgeon, I basically, my practice now exclusively is devoted to explantation, which basically means removal of saline and silicone implants from the many ladies that come to me from all over the world, literally in a manner to explant in the fashion that I do. And this is, as you will see shortly, a topic that is I use the word controversial. If you ask 100 plastic surgeons, 99 of them will certainly deny the fact that even exists, and that it is, quote, as termed a myth, and that it is all in your head for a topic that is as real as you will see, where I will highlight facts. And I will leave it up to the audience to, with an open mind, approach this and make a determination as to what is the best thing that they can offer themselves. As you will see, the patients have indeed taken the responsibility in their own hands. They have educated themselves. There is no other better mode of education other than the patients who themselves who have explanted, and to hear directly from them so that one can truly understand and comprehend the entire gist of what is explant surgery. The patients have nothing to gain or lose except for their fellow sisters' good health, period.
Well, that's all great points that I can't wait to touch on. The biggest one is that whole kind of mystifying conspiracy around it, that it's kind of a disbelief, it's all in your head. Now, anyone listening to this that knows me closely, they're probably wondering, how did you even hear about this? And honestly, my neighbor, who shall remain nameless, but she had breast implants. The implants that she had were recalled. I don't know, I'm kind of paraphrasing here. Were recalled because they were causing cancer or something along those lines. So she went into a deep dive into and found out what B.I.I. was. Yes, cancer and B.I.I., two separate topics in a way. But that led my wife, who has implants, to go down this B.I.I. rabbit hole. And she started telling me all the symptoms and stuff. And it almost to me was like when you see a commercial for a drug on TV, Nexium or one of these things, and they read off all these side effects that you could have. And it's just, you're kind of going, okay, why would you even take that drug with all those side effects? And then I'm like, in my head going, when I read all those side effects, kind of go, well, okay, that's probably never going to happen. And when my wife first told me about B.I.I., I was in the same boat as the 99%. I'm like, that's got to be once in a blue moon that those are connected. There are too many people with, too many women for that matter, with implants and plastic surgery that there's no way. If this was a thing, I think they would be either creating a new implant or it would be out there more. And then my wife brought up a great point. She goes, "Do you think all the plastic surgeons in the world want to stop doing breast implants? Do you think they want to like cut out all that money from their, life?" And I'm like, "Well, that's a great point." She's like, "You got to read some of these posts and complaints from women, and they're starting to correlate them to the breast implants." And so once I started this podcast, I said, "Well, that's, between me and her." She's like, "That'd be a great topic for you to talk about." And I think as controversial as it is, it shouldn't be really controversial. It should be more all these things, these kind of weird out there health topics. It's only better to talk about them so people kind of know, because there could be some lady that's going, "I have brain fog. I'm tired all the time." And someone's going to tell her, "Do you have low T? Are you seeing a therapist?" Are all these little things that they would add on. And like I've heard you say in other podcasts, yes, you need to rule out everything, just like you would do for any health complication that you might have. You wouldn't just, if you broke your back you wouldn't just go get surgery tomorrow. If they were like, "Hey, you might just need some injections," and you'd rule out all those things. But it's it's good that if people know that, oh, B.I.I is actually a thing, and if you do go through all these um, hoops to find out what's wrong with you, what might be wrong with you, it's nice to have the doctors, especially your primary care physician or whoever you're seeing, know that, oh, okay, this could be a possibility as well. And Dr. Kahn, I guess we could start off. What are some of the symptoms? I know I touched on a couple: the brain fog, the lack of energy, but I know there's a litany of more, which
Yes.
kind of makes it wild.
Yes. So breast implant illness is a constellation of signs and symptoms as a result of silicon toxicity that affects every organ system of the body. So these are the patients that present with the most common being brain fog, for example. You have fatigue, by far the most common symptom, where the patient will sleep 10, 12 hours and then still feel lethargic, lack of energy. The patient will have the rheumatological problems, joint pain, neck and back pain, and also psych issues, for example, emotional instability, suicidal ideation, anxiety, depression, among the many other symptoms that I have actually a questionnaire so that each and every single organ system is affected. Then if I will go from head to the toes, if you will, the hair follicles, the hair loss, for example, the migraine headaches, the vision disturbances, for example, the dryness of the eyes, sinus problems, ringing in the ears, vertigo, spinning, thyroid problems, endocrine problems. You have neck and back pain. You have basically dryness of the mouth as well. You have chest pain, certainly. You have patients that present with shortness of breath, tachycardia, arrhythmias, funny heartbeats. You have patients with difficulty with exertion. These are young ladies in their 20s and 30s, and patients with GI disturbances. They have patients have the joint problems, as I mentioned before, the fibromyalgia type symptoms. When they cannot think of anything, they say it's fibromyalgia. And these are young ladies. Again, you have problems with the reproductive cycle, premature menopause. You have ladies with problems with nerve pain, for example, the tingling numbness in the arms and legs, plantar fasciitis. They have a lot of fluid overload, if you will, inflammation all over the body. So these are the many different organ systems that are affected. Some more, some less, some come and go, some just present once. And as you will see, these are young ladies who have gone to the doctors, all the different rheumatologists, for example, the allergy immunologists, the primary care doctors primarily being involved, and they all say everything is negative. The lab workup is all negative. The ESR and the CRP, which are the main inflammatory markers,
Okay.
they are negative. The white blood cell count is negative. And then when they cannot find any lab work that attributes this to the implants, and they cannot attribute to the any imaging, for example, they might end up getting a mammogram or ultrasound or an MRI, and the implant is intact. Then by default, they say it cannot be the implants. They've been determined to be safe. And unfortunately, the the implants are not taken into consideration. And so, going back to your question, the breast implant illness are the symptoms that affect almost every organ system of the body. And this is where I have a questionnaire where the ladies check off and they kind of gauge, and I get a sense as to how seriously this the breast implant illness is affecting the patients. Some of the patients have three, four, five symptoms. Some of them are so involved that they're essentially bedridden, i.e., they cannot walk. They have difficulty with ambulation, for example. They're on a wheelchair.
That
They
is so
have,
crazy.
and again, this is the many ladies, literally from their 20s, 30s, where they are affected in a very negative way.
That it's got to be insanely frustrating too to for a woman to go for anybody in general if they have a health thing that they can't figure out. I've been in that position, and it will drive you slightly insane. And I couldn't imagine it. You're going through all these tests, and the doctor keeps telling you, well, and then this lady, let's say Jane happens to come across B.I.I, and then she goes to her doctor and she goes, "Have you ever heard of B.I.I?" And they're like, "No, no way." And then she shows them some data, and they go, "No, yeah, it's remotely impossible." Blah blah blah, and then they still can't figure it out. And what do you say? What's being done to kind of drive the wedge a little bit and say, "Hey, there is these. We're not doing like uh, placebo study cases of these things because it's kind of impossible to do." But we have all these women here that have these issues, and they've gone through the similar testings, and they're experiencing the same things. And firsthand that you've explant, right? Correct. That's the
Yes,
correct
yes,
term.
yes.
You performed explants on quite a few women, and instantly they're like within 24 to 48 hours, they're starting to feel some symptom relief. Correct.
Yes, so exactly. So there are, so the first thing I want to point out here is that I want the patients to go to their doctors and to get a battery of tests, lab workup, for example. And now these are not like infinite. After like 20 tests, for example, a comprehensive metabolic panel, is complete blood cell count, for example. You got the thyroid labs, for example, along with vitamin B12, amongst many others. One can rule out a lot of problems. Now, I tell my patients, go to the rheumatologist, go to your primary care doctor or the allergy, get the workup just to make sure that you don't have a cardiac arrhythmia, for example. You get the Holter
Sure.
monitor or the echo. Now, a young lady where you have so many of these symptoms checked off and you have nothing else, the more and more fingers now are pointing towards breast implant illness because there is nothing else to account for it. Now, we know with certainty, and what you just mentioned, you just look at the patient's faces, the before and after. I
Right.
request my listeners to just go to Google, type in before after faces explantation, which is removal of the implant plus the capsule, and you will see the before after. And these are the many young ladies, middle age and the elderly. Basically, they will, and they post where their dramatic recovery within hours, sometimes days. Now, in some patients, for example, that have 1978 implant or the 1980 implant, that is much older technology where the implant's been ruptured for a decade or
Wow.
5 years, for example, some of the silicone leaches into the lymph nodes and into the periphery. Now, even after removal of the implant, the patient may not seek the relief that they need. Now, that patient is very different compared to another patient that had just gotten implants 6 years ago, for example, where it's not ruptured, and the patient is not exhibiting these sign symptoms. And I just going to want to highlight, some people say, well, it's is a minority of the patients that will exhibit breast implant illness. Ultimately, 100% of the patients will exhibit breast implant illness, some sooner. And in my practice, I've had a 22-year-old that started within 2 weeks, very adversely being affected by the implants. And I have had ladies that present to me, for example, this nice lady from Argentina. She had implants from almost 25 years ago, and she had a fall. And as a result of the fall, she had a rupture, and now she was having pain and capsular contracture. And that certainly has led to what is the silicone extravasation outside of the implant, causing the pain, discomfort, and the misery. And the other one that is not ruptured, has what are calcifications, capsular contracture, because the body in itself is trying to protect. And the point here is ultimately all women. Now let's go ahead and look at facts. This is not me. This is the FDA, which is, the governing body that's responsible for ensuring good health and the safety of the implants, not only breast implants, but let's say cardiac pacemakers or lap ports, for
Sure.
example, or
Knee
so the FDA
replacements, anything like
yeah,
that.
knee replacement. So the FDA has mentioned, now these are facts. This is like independent on me. This is not my opinion. These are hard established facts. Fact number one, they themselves mention that implants are not lifelong devices. FDA fact number two, implants are associated with breast implant associated anaplastic large cell lymphoma, meaning the textured implants, like your neighbor does, are a direct cause and effect of what is B.I.I, breast implant associated anaplastic large cell lymphoma, and that if she did not have the textured implants, she would not have gotten the lymphoma. So it's a direct result. And not only textured implants, but also smooth implants and also saline implants have also been implicated in causing the B.I.A ALCL. And just
Wow.
recently, the FDA mentioned 3 months ago or so that squamous cell cancer has also been associated with breast implants. And the third thing that the FDA has mentioned, that there is such a thing called breast implant illness, and patients who remove the implants achieve cure, i.e., complete resolution. So I'm going to quote the FDA: complete resolution of their signs symptoms once the implants are removed. Now these are the three hard facts, if you will, from the FDA. Now this is not new. If you go back and look in history, in 1992, the silicone implants were banned for the same reason. And what
Hmm.
happened was, from 1992 to 2007, the silicone implants could not be inserted in the body unless you were part of an experimental study. And then in 2007, the FDA allowed implants to be uh, put on the market as long as studies were being done, and they were supposed to be the cohesive implant, which are the gummy bear, which do not rupture per se. And lo
Hmm.
and behold, as history is repeating itself, these cohesive implants are absolutely not safe. They're still rupturing. My patient, she had 3.5 years into her augmentation, a rupture despite a cohesive implant, and she had the many signs symptoms of what is breast implant illness. Now,
Wow.
let's go ahead and look at, so these are the three facts. And again, I want you to go ahead and look at the FDA warning. Now, another series of facts from the mentor manufacturer of the breast implant itself. So if you go to the mentor website, you will see this. And again, this is not my opinion. This is the manufacturer of the implant itself, Mentor, the number one manufacturer in the US. It states, number one, the breast implants are not lifelong devices, the BIALCL. And then again, the third fact, which is that breast implant illness is real and that there is, quote, complete resolution of the signs and symptoms of breast implant illness. They also mention that breast implants must not be inserted in patients who have active infection, who have breast cancer that needs to be treated. They also mentioned that breast implants must not be inserted in patients who are pregnant or nursing.
Hmm.
They also mentioned the mentor ad itself. Again, these are hard facts. This is not my opinion. The mentor ad also mentions that the patients who have mental illness like depression or mental instability should not get implants.
Hmm.
They also mentioned patients who have autoimmune issues should also not get implants because of the detrimental effects of the implants themselves. And then the last thing I want to highlight here is Mentor itself says in the advertisement that ladies who have Mentor silicone implants should get an MRI at year 3 into their augmentation, and then every 2 years they're onward for the life of the implant, so that they can detect, MRI can detect a silent rupture. And this
Wow.
is by the mentor manufacturer itself. Now, this is huge if you ask me. If you take the information from the FDA that I just
Hmm.
highlighted and the information from the mentor advertisement itself that the manufacturers put forth, one, if they analyze with an open mind, you would ask, why on earth would anyone want to get implants? Because these are all red flags. Someone's
Sure.
telling you you're going to get cancer, you're going to get B.I.I, breast implant illness, and they're not lifelong devices. So if someone is 20, for example, and she lives to God, the average age of the woman in the US 80s, two, for example, so she would at least change the implant maybe 6 times in her life, let alone all the other problems. Now, let me highlight what is the problem with breast implants. Fact number one, silicone toxicity, the leaching of the silicone that starts occurring from day one. Fact. You can see me. I have saline implants that is intact. I remove the capsule, and there's a small film, slime, if you will, that is
Hmm.
present. And if I go like this, I can see what is that gum sign where the silicone is noted to be in between my gloves by default, because this is what is slowly leaching out in the body.
Hmm.
Patients, 1 out of 8 or 9 women are going to get breast cancer. Now they cannot do a self monthly breast exam. And now that implant is going to obscure a nice, good physical exam. Patients are afraid to get mammograms because they're afraid their saline implant or the silicone implant might rupture, or they might hurt. They are sometimes in pain. Patients get infection, capsular contracture, asymmetry, malpositioning. Patients also, when the implant in the majority of the cases is put below the pectoralis muscle, the entire pectoralis major function is compromised, and the anterior stabilization of the shoulder, for example, because the muscle inserts into the humerus, the pectoralis major, you find the patients complaining of neck and back pain as a direct result, not only of the weight of the implant
Wait.
itself, but also the compromised function of the pectoralis major, amongst the many, many, many other reasons that I just highlighted. And so this is, if you ask me, implants are not safe devices. They are replete with problems, and I cannot even imagine why anyone would want to have such a device in their body and cause all this, quote, lack of a better word, death and destruction, right? It
Right.
causes death. How many patients have committed suicide? You can see and hear directly from the patients. I have a news reporter here in Michigan. She herself,
Hmm.
she told me she wrote a will, and she took a gun out and went to the woods. And when an attempt, she's like, I don't want to live like this. And she didn't know if it was the implants. And there are patients that I talk to on a daily basis, which you
Whoa.
highlighted earlier, who have not even heard of the breast implant illness. The doctors keep saying that you're in good health, good shape, that it's all in your head. These are the 33-year-old moms who are like, hey,
Prob-
I think I have 3 kids that's driving me in a stressful life. It's actually not that. It is the implants, because you have so many signs, symptoms on that checklist that point towards what is breast implant illness. Now, I just want to go ahead and make one more point. I say
of
to
course.
everyone, to you, don't listen to me. Listen to the FDA, listen to the manufacturer, and most importantly, what I highlighted earlier, listen to the patients. They will tell you, I got the implants out and I feel like $1 million. Sometimes as soon as an hour, sometimes a week later, a month later. And the patients are all so happy that they have gotten their life back, and they have no worries when the implants are removed.
Now I'm guessing it's so wild to me that, I mean, I guess it's not wild because on a pack of cigarettes, it's got the warning on there, don't smoke cigarettes if you're pregnant, and they cause cancer and this and that, and people still be lighting up them cigarettes as, quick as they can. Probably less more these days, but since it's moved on to vaping and all that, all with the same complications.
Yes.
As far as the smoking world goes. How does the other plastic surgeons, like you said, how many? First of all, how many plastic surgeons are out there like you that are kind of advocating again? I don't want to put words in your mouth, but advocating against putting implants in, and that you shouldn't do
So
it whatsoever.
yeah, I'm 100% for complete ban on not only silicone but saline implants. 100%. Like the next
Wow.
second, if I could, if I was given, look at what I just said, right? Do you
Right.
want to
Of
cause
course.
harm? We took
Sure.
an oath: do no harm. We are harming the patients, right? These are devices created by the manufacturers that are hurting the patients, right? They're affecting their quality of life. Every aspect of their life is affected, from all these organ systems. Now, I'm going to speak on my behalf. As you will
Sure.
see, there is a trend across the country where the patients themselves are taking the health into their own hands. They themselves are overriding their doctors. Now, if you look at the fact, if you ask me, here's a 5-year-old kid, go ahead and take care of him as a doctor. I'm going to say I use the word, I'm not a pediatrician. If you ask me to manage, OBGYN procedures, or, function as an OBGYN or allergy immunologist or a cardiologist, I'm going to say to you, without a doubt, I have no idea how to uh, basically function as a cardiologist. Likewise, I
Of
wouldn't
course.
expect a rheumatologist, or a primary care doctor or an allergy immunologist to go ahead and comment on what is breast implant illness. So this is not their area of expertise. Now, one can only just go look at the history, and you will see the same set of problems are essentially repeating themselves. If you look at the publications, they are coming out slowly, and where research is being done. This
About
is
BII.
B.I.I. For example, Dr. Feng out of Ohio, for example, has published and presented at the plastic surgery societies. There are other doctors that are coming forth that are presenting their data on explantation. For example, the study out of the plastic surgery group in Utah, where they mentioned well over 90% of the patients sought relief with explantation, and that explantation is the cure to the many signs and symptoms. There are
It's so crazy.
many surgeons. So, another thing that I speak on behalf of the Plastic Surgery Society and the plastic surgeons, uh, there are a lot of plastic surgeons who have stopped augmenting. And from what I hear by word of mouth, I have not heard directly from them. There are 7 of them or so who used to augment, and now they have stopped augment. This is a huge step.
Sure.
And now another fact here is, if you go to 10 different explant surgeons, you're going to find that you are going to get 10 different techniques, solutions, ways of approaching explantation, which is interesting. But there is a unique way, I use the word, of doing this. Now I'm going to speak on from my experience. I If you look at the vast majority of the implants, they're underneath the muscle. Just to do an explant, for example, takes me 4 hours, sometimes 5, sometimes three
Damn.
and a half. If this is today, for example, I did a 550cc implant. This is a very different implant than the smallest one that I did, which was almost 3 months ago, 125 cc's. As you can imagine, it's sitting over a smaller area. The
Sure.
dissection of the rib is not as involved, simply because over here today, the implant was sitting over 5 ribs. So I have to dissect directly over. The entire purpose of the surgery is this: to remove the implant, the capsule, and all of the inflamed tissue. The capsule, 100% of it must be removed definitively, along with the inflamed tissue that's in the periphery where this leaching has occurred, and to send it off to pathology to rule out the cancer, the BILCL, the squamous cell pathology, breast cancer, among others, and to have that peace of mind and confidence that there is nothing inflamed left behind, and that there is no inflammatory burden. Because if that is left behind, i.e., 10, 15, 20% of the capsule, the patient will continue to hurt. Why do we know this? If you look at 2 things. Number one, if you look at this, just the pathology reports, you will see that within the capsule itself are these silicon particles, impurities, toxicities, that
Hmm.
if left behind, they will continue to trigger this breast implant illness. Because
Of
remember,
course.
this is the body fighting the foreign body, which is a silicon implant. The second thing is, we know from a whole group of patients who removed the implant, but the capsule was not removed, and then they continue to have the same sign symptoms as if they had implants, minus the implants. And then when they sought consultation and surgery for removal of residual capsules, then they bounced back to the normal state of good health minus this residual capsules. without the silicone toxicity, where they were now free of the many symptoms of breast implant illness. So again, the point here is your doctor must religiously, sincerely, definitively remove all of the capsule, because post-operatively the patient wants to have the peace of mind, that confidence that your surgeon is removing all of the capsule plus all of the inflamed tissue and testing it for cancer, breast cancer, inflamed tissue. Because if it's not tested, we won't know. Now, one of
Sure.
the things that the FDA has very clearly highlighted is the fact that BIALCL, which is the lymphoma associated with breast cancer, with the breast implants, this cancer is very much underreported.
Wow.
This is the BIALCL, because not everyone is sending the capsules off to pathology. Or if there is any abnormal fluid, the fluid is not being sent to cytology for CD30 analysis, and even the capsule is not being sent. So now we're missing the BIALCL as a direct result, and also the squamous cell cancer. So the capsules must be sent so that you have the peace of mind. Now, going back to the question you asked in
Hmm.
regards to your surgeon. Now, B.I.I is a real entity, the breast implant illness. Your surgeon must, first of all, openly on social media and in direct consultation, openly accept the fact that breast implant illness exists. I had a patient that went to a plastic surgeon
Hmm.
who said, I don't want to talk about breast implant illness on social media because it's going to deter many of my other patients who are interested in getting augmented. That is an absolute no. You cannot
Makes no
put an
sense.
implant, yeah, you cannot, like you have heard me say that the earth is flat and also the earth is round at the same time. You cannot get both. You have to, as a professional expert, only be explanting. You should not be augmenting, and that authenticates, certifies, and gives the confidence to the patient that your surgeon is genuine. And I use the word genuine because you cannot
Right.
have it both ways. You cannot be putting in implants, because remember I said earlier, all patients are going to succumb to breast implant illness when they do get implants. Not like, hey, you're going to be spared, and no one can predict that you're going to get it next year or 5 years. On average, the FDA said they last 10 to 15 years. From my practice, 7 to 10. So the first,
Gotcha.
going back to your point about the plastic surgeons, your plastic surgeon must openly accept the fact that breast implant illness exists. Number two, should not be augmenting. Number three, when they are explanting, they should have a very defined way and have a transparency with the patient, so the patient feels comfortable what he or she is going to do. And this is where I tell the patients, do your homework on me, on the other plastic surgeon. Talk to the previous plastic surgeon's patients so that you have that confidence. And this
As
is,
you should do with any of your
yeah,
doctors.
yeah, because and yeah, absolutely, because you don't want to be post-operatively thinking that, oh, I got this done, and now all of a sudden you have these symptoms, and you've gone through the financial burden, the physical pain and burden, and plus the second surgery is not as easy as the first one, as far as, because there's more scar tissue.
I'm
So
sure.
they're prone to more problems. And the point I'm trying to make here is that patients have to do their homework. You cannot just look at a list. Nowadays, what I find extremely unfortunate and wrong and unprofessional is a Facebook group owner who has no concept of medicine, has never stepped into the operating room, is not even a doctor, not even a nurse, has explanted, is now passing professional judgment
Mm.
into how the capsules are looking, accepting donations from plastic surgeons and whoever
Mm.
it may be across
Hmm.
the world, and preferentially highlighting them as to be the experts in breast implant illness, which is absolutely unacceptable if you ask me. And if you ask me, according to the law, illegal. Now, I want the patients to themselves do the homework, and basically, you will get that confidence once you talk to the surgeon. Don't talk to the nurse, don't talk to the physician assistant. This is a direct relationship the patient must have with their plastic surgeon, where the plastic surgeon and the patient should be actively discussing, talking, and this is where the patient is going to get that direct feedback, such that when that consent form is written, it's going to state end block resection, which is complete removal of the implant capsule without a break in the capsule, or 100% total capsulectomy, which means 100% of the capsule is removed and all of the inflamed tissue. And that what I say are the 5 criteria that essentially gives the patient a confidence that your surgeon is a good surgeon who truly believes in breast implant illness and is truly out there. Now, I will tell you from a financial perspective, if I were to start augmenting, now I'm the only plastic surgeon, and I say this very humbly with confidence, who has never augmented except for the one case in order to get board certified.
Wow.
And
That's crazy.
I purposefully, if I was augmenting, my net income would be 3 times at least
Of
what I'm
course.
making. And so it's a financial hit. And so it's a
Hmm.
big deal for a plastic surgeon to give up what they thought and to study for so many, like I would say decades. Literally, that's how long it takes. If you factor in from undergrad to the medical school to the 10 years of training that I mentioned, it's been a very tough task, and it
Oh,
is
for
not
sure.
easy. So going back to the point here is your plastic surgeon, number one. So what are the criteria, for example? And I say this very humbly from my experience. Number one, the length of time. I've seen some patients say, oh, my surgeon's going to take an hour and a half. That is wrong. I myself, on average, take 4 hours for a case. Now, sometimes I finish a little bit earlier because there was a contracture or it was an easier dissection. The patient was a little bit on the obese side, so there was a fatty pad. I was able to dissect in between, and the ease surgery went relatively well because it was above the muscle, for example. So the
Mm.
length of time on average is 4 hours. You cannot fast forward this surgery. The smartest surgeon is the one who takes the 4 hours, and this is from my humble experience. Number two, your incision size should be the diameter of the implant. So you cannot remove a uh, large implant, let's say 500 cc's, from a 2 or 3 or 4 centimeter incision, because you have to remove it intact, right? And you have to be able to visualize the entire capsule that's sitting directly on top of the rib, which is the hardest part of the case.
Mm.
Number three, you have to return the implants to the patient so that the patients know the saline implant was not ruptured and that the silicone was indeed removed. And you want to have mental closure, psychological closure, that this implant was inside the body and now has been removed. And this is matches the card. You'll be surprised how many times the implant is not what was supposed to be the case. One was a mentor, the other one is Allergan, for example. One
Oh,
was
wow.
above, one was below, one was a different make. The other one was, as far as the size difference, for example, the patient was, has the card, it doesn't match the lot number.
Mm.
Number four, you want to have a video of the chest. This is probably the most important part, showing that complete removal of the implant capsule and that there is no residual capsule. You see the raw ribs, you see the periosteum, the perichondrium, the fascia of the serratus anterior, the fascia of the intercostal, the fascia of the pectoralis minor. This is the dissection off of the chest, directly off of the rib, completely removed and void of the capsule, because there is no fascia remaining. That kind of certifies or ensures that there is no capsule remaining, because the capsule sits directly on top of the rib. And in order to remove the capsule definitively, it is not enough just to bovie the capsule and then you burn it, because you still leave the silicone behind that way,
Hmm.
the silicone particle. So you have to physically eliminate, remove the fascia of the intercostal muscle, the serratus anterior, the pectoralis minor, the periosteum, perichondrium, such that all of the capsule is definitively removed and there is no burden remaining behind. You want to see a video of cutting open of the capsules. You want to see the pictures, the high definition pictures of the chest, where
Wow.
there's light going in and there is, a video showing that the entire capsule was removed, because that is the hard evidence you want to see. And then
Sure.
last but not least, I have an internet presence. I have a social media stamp of approval. All my
Hmm.
patients are talking about me, not only on my website, on my Facebook private illness support group, but they're talking on all these other Facebooks, on Instagram,
Correct.
on TikTok. And, again, these are private messages that are constantly being exchanged. So this, if you ask me, truly authenticates a plastic surgeon and reaffirms that, he is still good. He continues to be good. and that he's not slacking, or he's not, oh, for example, this young lady, the surgery was above, the implant and the capsule was above the muscle, or she had a, so that's an easier surgery. The harder surgeries, for example, a 55-year-old lady with Crohn's disease on an immunomodulator or on prednisone, she's a tougher
God.
patient. No, she gets the same surgery as the 22-year-old, for example, because you don't want
Sure.
to compromise because of age or the patient's health. So this is where all the surgeries must be done with that standardized thought process and conviction and that determination that all of the capsule inflamed tissue implant must be removed sincerely, definitively, and it can absolutely be done 100% of the time, such that
Wow.
post-op the patient has the peace of mind, and patient can look at the surgeon in the eye, and the surgeon can look at the patient in the eye and say that I got it all, because that is what is required for the patient to bounce back to a normal state of good health minus these toxins.
So you brought it up, all amazing points, and I appreciate you deep diving with me right now. Why isn't it covered by insurance? And how in the world is it? I'm sure it's going to be one hell of an uphill battle to make it, covered by insurance. I don't understand why they still are. Insurance companies are still making their money. So, if anything, they should be happy. Look, they use their insurance to get breast implants. Now they're going to use the insurance again to get the explant. Why is it so taboo? And oh yeah, nope, insurance not going to cover it. You're going to have to come out of pocket. And if you don't have the money, and no one's going to give you the money, you're going to have to just suffer because it was your decision. One of those kind of stupid reasons to not help someone.
Sure, sure, sure. No, that's a very good question, and I'm glad you asked me this. So, there are two reasons why patients get implants. Number one, cosmetic. The other one, cancer. So let's go ahead and talk about cosmetic patients. The insurance says this. Now let's look at facts. The textured implants have been banned in the US, France. France was the first country that basically stepped up and said, we're going to ban textured implants. When these ladies who had the textured implants, they were told not to go and they were not recalled.
Mm.
They were told, beware, you have implants that are textured. They've been associated with B.I.I, live happily ever after. If you have problems, go get help.
Okay.
They
Have a
and
nice day.
yeah. No, that's exactly right. No, I live in the Motor City in Detroit. You got a airbag problem. I remember I once was driving a rental. I'm not making this up. I'm not exaggerating. The rental car company called me and said, "We just got notification. You're driving a car that has a recall. We're gonna." I said, "I cannot come. I'm busy." They said, we are gonna tow a car. We're gonna bring a tow truck to you. We're gonna give you a loaner car, and we're gonna tow this one back, wherever you are. I said, I'm gonna bring it back tomorrow. I will stick with this car. No, it was that big of a deal
Wow.
because they didn't want to get into trouble.
Of
Me
course not.
trouble. Now, in this case, with the textured implants, the FDA 10 months later asked Allergan, did you go out and reach these patients? Kind of follow up. But they never told them, or they did not cause this mass panic. Go get them removed because you will get breast cancer. So this is not what was told. They didn't say go get a recall.
Right.
Now, when the insurance companies were told, because I've removed a lot of textured implants, these have been banned. The insurance companies have said, who told you to get it for cosmetic reasons?
Of course.
That's your burden. If you get a facelift, it gets infected, you go to the emergency room, the entire burden's on you. Likewise, the insurance companies have said, who's telling you to remove them? No, they say, well, if you have capsular contracture, grade 3, grade 4, now depending on the insurance, or
Okay.
if you have a rupture, then we will cover that one, maybe not the other. Now, let's go ahead and look at facts again. The number one reason for bankruptcy in the United States is medical bills, period. Established fact, no denying. Fact number two, the entire health system in the United States is messed up, lack of a better word. It is not fair.
I
The
know what
burden
word you wanted to use.
the burden is put on the patient.
Right.
The insurance companies have put high deductibles along with the employers who offer the insurance, 5,000, 7,500, 12,500. I was operating once, and I was doing a case, and all of a sudden, this was at the hospital, uh, 7 years ago or so, and all of a sudden, my assistant let go of the instrument. I was like, "What are you trying to do?" I'm doing a case at the hospital. And
Hmm.
he's like, "I got carpal tunnel." I said, "Go get your surgery." He said, "My deductible is so much, I cannot afford the surgery."
That's ridiculous.
And this is the reality of American
Oh yeah.
medicine, unfortunately. So the burden is being passed on onto the patients, the high deductibles, insurance companies that are collecting all the money, the emergency rooms, along with all the doctors, they're looking for schemes and ways to stay afloat.
The
Now,
hospitals are,
the
the
hospitals,
CEOs and the CFOs.
the hospitals are corrupt institutions. No, ask any. I want any of your listeners who work in hospital administration, or even as a doctor or as a nurse. And I'm not making this up, I'm not exaggerating. I am here in a very professional, honest way giving this information. It's no secret. You ask anyone in the health profession, they will tell you the corruption of medicine. So now going back to
Really
the
quick, I'd like to give it.
doctors themselves, if you look at the reimbursement from what it was 20 years ago, 10 years ago, 5 years ago, even after now, January 2023, you will see the reimbursement rates for everything has gone down.
Mm,
If you look at a colonoscopy, for example, just to use that, and I've used that before, the reimbursement here for the state of Michigan for a colonoscopy for a GI doctor for his professional fee to do a scope, which is a very invasive procedure, without any biopsies, is $205.76. The appendectomy, for example, to basically take care of a ruptured appendix,
right.
non-complicated, you're looking at a few $100s. Gallbladder, same thing. To remove an implant, they first say, "Who told you to remove the capsule?" That's not part of the theme.
Surgery.
It
Hmm.
is part of the theme. That's the gist of the whole surgery. And then many of the docs who take insurance, they will rupture a saline implant, remove it in 10, 15 minutes, literally, without removing the capsule or the inflamed tissue, without studying it, meaning the capsule, without sending it to pathology. And the reimbursement rate is essentially minimal to none. So I see my patients who submit to insurance, and 500, 700, $1,200. Now, I'll tell you this: if anyone, plastic surgeon, who removes implants and spends 4 hours along with a team that is certified nurse, certified assistant, certified surgical tech, certified CRNA, or MDA, which is the anesthesiologist, you will not. This is a recipe for chapter 11. No plastic surgeon will, unless they work for a hospital, and the hospital now is going to find its way, but
Sure.
still the hospital will not be able to justify a full surgery for 5, 7, $1,200. And I will tell you, I assure you with 100% confidence, without a doubt, if your surgeon is taking insurance to remove the implants, he or she will not remove the whole capsule. It will be a quick hour-long case, hour and a half, and there will be, quote, other creative ways to build the insurance so as to at least make some financial gain out of what is a really involved process. So I say to you, if you look at the many explant uh, surgeons, for example, they will only do the surgery because this is a big deal, especially if the moment you go to the hospital, all of a sudden you have all these exaggerated costs of going into the hospital the moment you step foot. So you have to be done in a very realistic way, reasonable way, at a private surgery setting once you meet criteria for that reason. So going
Hmm.
back to your point, the insurance companies don't want to even acknowledge there is no ICD-10 code. So they will never reimburse the surgeon for his or her time. And any plastic surgeon, I'll say this again, who takes insurance to remove implants will do an incomplete job. He or she will not understand breast implant unless they will not spend the 4 hours just to explant, because it will not justify the time, the effort into going into removing the implant and capsule definitively, sincerely, period. So
Right.
now the patient is left with the burden of footing the bill, into removing the entirety of the implant capsule definitively, and to have the right surgeon who will do this surgery in the right, correct manner, period. Because the reimbursement is nil. Now, if you will, the administrative societies like the FDA, for example, the Department of Health, need to mandate. There are so many patients who want to remove the implants, right? But they unfortunately, given the financial situation we are in because of COVID, and amongst the many other patients who were probably well off back then, but now it's not easy to spend what would be approximately $10,000 or so in order to remove the entirety of the implant capsule. But in today's age, if you get braces, that's $3,500, $5,500 in a heartbeat, right?
Right.
You know, and if you think about the level of surgery, it is a very involved surgery. And now one
Hmm.
has to factor in, I want to go ahead and highlight this also. Fat grafting is a very bad, foolish idea. I use that word.
What is fat grafting
Fat
for people
grafting
that don't know?
means that you harvest the fat from the abdomen, from the thigh, wherever you have these fat deposits. And then once the implant is removed, the fat is injected in order to provide volume so that
Okay.
the patient at least has some. Now, I will tell you in that case, for example, some patients, this is what happens. They get an explant, but then they pay for the fat grafting, which is for cosmetic reasons, right?
Of
So the
course.
insurance doesn't cover. So the surgeons now are able to somewhat justify doing an explant, supposedly, right? With a big question mark, along with fat grafting, because now this is the cash incentive to proceed. I will tell you, 50% of the fat is going to die, guaranteed. There is no denying the fact. And now, when the patient is doing the self monthly breast exam, that fat deposit might become a fat necrosis. Half of the fat is already gone. And now, when you do a mammogram or a self monthly breast exam, you're thrown off. Is this a mass? Is this cancer?
Sure.
Or if this is something that needs to be worked up with a biopsy, and now unnecessary trips to the doc for something that truly could and should and must be avoided. So, fat grafting is a bad idea. Somehow, I find some plastic surgeons supplementing their practice by doing the fat grafting in order to supplement their income and when it comes to explanting. So that is a bad idea. And also I find lift. So in my practice, I don't do lifts because remember, I do what is essential surgery. This is non-cosmetic surgery. And I find from my experience that vast majority of the patients, when the surgery is done right with the proper techniques, 80% of my patients are not candidates for a lift because they did not need one,
Hmm.
especially the 20, 30-year olds, even the 40-year olds, and then the 50-year olds. There are patients that I see and I say, look, you have 750 or 800 cc implant. This was displaced down, bottoming out. You will need one, but now for me, you are going to be on the OR table for 4 hours, 5 hours, especially given the size of the implant.
Right.
This is at the level of the rib. The entire lift is done at the level of the nipple areola complex. And this is not the time to be doing a lift when the tissue is inflamed and angry and irritated. And the lift operation in itself is a 3-4 hour operation
Hmm.
at least. So you don't want to be compounding or having the patient be on the OR table for
7 hours.
8 hours. And the next thing you know, after 6 hours of being on the operating room table, the risk for clot, infection, DVT, dehiscence of the wound, problems breathing, as far
Danger
as
zone.
anesthesia, they go up significantly to the point where the rule of thumb is 6 hours. You should start wrapping up and getting the patient off the table. There are reports of patient with skin necrosis amongst many other problems. So hopefully I go back to answering your question that the insurance will never, I use the word never, cover this. The reimbursement rate is so shabby, be it anything, that no doctor, and I say this again, this is a broad statement that I'm going to make, who is in private practice taking insurance can float their practice. You're looking at internal medicine doctors, for example,
Right.
making $35, $55 a patient.
Hmm.
This is not justifiable for private practice. Now you see, I did, as a plastic surgeon, I did a lot of face cancer, for example, skin cancer, leg reconstructions, burn patients, for example. I did a lot of other
Sure.
patients who with hand surgery. You find doctors now saying, I'm going to get an x-ray on every patient that comes in. I'm going to sell a splint to them. I'm going to go ahead and get hand therapy out of them. And the next thing you know, it's not only the doctor's fee, but the therapy, the the therapy, for example, the splint that is there, and all these other. If we add all of these all now become a financial motive for a doc to incentivize or privatize their practice in order to again be creative into making money. So going back to
Sure.
the point here, the reimbursement rates are so bad and so poor, they have compromised care where you have non-MDs now running the medical practices, and the quality absolutely has gone down where there is no financial incentive for the private doctors to be doing something that only pays minimal to no amount that will never float a private practice, be it the plastic surgeons.
Lost him for a second. Had a little connection hiccup. Man, well, while his connection's getting fixed for a second, holy crap, it was heavy, so far heavy. I don't even know if he can hear me right now. Let me, but my goodness, I'm gonna let him call back in again. That, there's so many things. It's so wild to me that that's. I mean, I guess it shouldn't be wild to me because, like I brought up about cigarettes, they're don't smoke. They give you cancer. They'll fucking kill you. And then people are like, yeah, dude, let me get some cigarettes. It's like, yeah, okay. But I mean, same with drinking and many of the other things that a lot of people do, including myself. Because I still drink. It's definitely not good for me. It's even in moderation, whatever people want to say, it's not good for you, bro. um, but I could not imagine just there's something I want to ask him. How much does it cost? Sounded like it said $10,000, which it's not millions, but that's a lot of money these days. Just to have somebody tell you, your doctor's basically, nope, yeah, it's all in your head. And meanwhile, you're reading all these things that are saying that could be your breast implant. And meanwhile, you're trying to find a way to pay to have it done. I really am curious what they do for people when it's just what do they say? What do the doctors say with all these women? Hey, welcome back, Dr. Kahn.
All right. I do not know what happened, but
It's okay.
back on. Yes.
I gotcha. I was doing you didn't miss much. I just was saying how heavy all the information is. And it's not even, it is a lot of information, but it's just wild to me that it's so, nope, we're not going to cover by insurance. And then I wonder, so you said about $10,000 to get the surgery done, correct? I just
Yes.
wanted to clear that out. Do you how many shitty phone calls do you get from doctors? Do they call you at all or shoot you a text like, "Hey man, you really need to stop with the
What I would
propaganda."
say, an honest, reliable, quality service. I have nothing to gain except for my patient's health. I speak from my heart. All
I can
I
tell.
want, yeah, yeah. And I say this, I want each and every single listener, doctor, MD, plastic surgeon, physician, PA, nurse practitioner, whoever it is, lawyer, journalist, listener, anyone, all over the world, whoever is listening, fact checked every single word and letter that I have said and on your show tonight, on your
That's
podcast.
right.
The FDA warning, the mentor ad, this position of the hospitals, right? The position of the plastic surgeons. These are hard established facts. I didn't make any of this up. I'm just putting it all together. And I want each and every single patient to formulate their own opinion and to look into and dissect, read between the lines. And I want you to get back with me if I said even one thing incorrect or exaggerated. So I'm very careful. This is my reputation, this is my practice. And again, like I said, I have nothing to gain except for the the patient's good health. I evaluate each and every single patient myself. I don't have a team evaluating, but I'm the single force, if you will, from the first phone call. There are patients that I talk to. I screen the patients. I make sure that they are well, you know, research into, if they have history of breast cancer, they had alloderm reconstruction, what was implant, if they need an MRI, for example, and again, patients from all walks of life with all the medical problems as you can imagine. And so it is an involved topic. And I say this, one of my friends, who's a plastic surgeon, he called me up, and he's a well-wisher. He's a good friend of mine. And he said, well, Kahn, I'm afraid for you. You're talking about this, and I feel like you're going to get into trouble. And
Right.
I said, I like you a lot. You're vouching for me, and looking after me here. I said, listen, what am I doing? He's like, you're posting a lot of videos from your OR. I said, that's very healthy. If you ask me, I'm being transparent, right? Because I want each and every single plastic surgeon to be transparent so that
Right.
the patients know what they're doing. I said, what am I doing? It just look, let's analyze. I'm removing the implant. I'm removing the capsule and any inflamed tissue.
Mm-hmm.
And I'm closing the chest. I'm not doing anything fancy like fat grafting. I am not doing a lift, and I tell the patients well in advance, this is essential surgery. You don't want to be doing a lift, especially, what's the chance that you did the lift and you did not need it?
Of course.
And then this B.I.I, I'm ruling that out. I'm ensuring complete removal of the capsule. And look, remember the FDA said you have to send the capsule off to pathology in order to rule out the B.I.L.C.L. And you're doing a CD30 analysis. Because if this is cancer, you have to go back and remove it. Now, we do not know. We don't want to be going back in again. And so, and there's nothing wrong in removing the capsule. If anything, all good, because
Mm-hmm.
we know. And then I'm testing the capsule for the giant cell reaction, histocytic reaction, chronic inflammation, right? Sometimes fat necrosis. Sometimes I've seen fibroadenoma. Sometimes I've seen, the silica within. And so this is all done in a very controlled, safe outpatient surgery where I'm screening the patients. They are feeling better. Listen to them. Don't listen to me. Just I
Right.
request my listeners, go to my private page. Go to executiveplasticsurgeon.com. That's my webpage. And then through that, you can go to my private breast implant illness support group page by Dr. Kahn. And I say to you, to the FDA, to the doctors, the physicians, just listen to my patients. I have nothing to gain. They're only feeling better, happier, they're mentally free, more energy. They, as they get older, don't have to worry about rupture of the implants, for example, which they're only inevitably going to rupture. Remember, the FDA has said 10 to 15 years. They say if you have problem, take it out. So I'm removing the implant plus the capsule, right? And so if anything, this is the norm, and this is the accepted norm. And I'm doing what is, many people recognize this to be a good, healthy thing to do in the middle of the pandemic when everything was shut down, and they were not even doing rotator cuff or knee surgeries, right?
Nothing.
There are patients with appendicitis, and they were cooling them down with antibiotics. 9 o'clock prime time on a Monday morning, I was able to get 4 hour block time to do explant surgery, removal of implant capsule, because the OR committee, the doctors, the anesthesia team knew that I was offering essential surgery. And if the doctors are a professional group of people, if you tell them and you discuss with them what is your indication, and this is non-cosmetic surgery, this is essential, they will honor and respect you. And the plastic surgeons, look, 3 years ago, from what I understood, there was two other docs who were only explanting, they were not augmenting. Now, from what I told you earlier, there are 7 that I know of.
Wow.
And this
That
is
that's
a good
so
healthy thing.
that solely do the explanting, correct?
That's only, yep. So they're not. Now, I will say this too. Hopefully next year we're going to have 20 more. And if each of them start talking and actively discussing what I am talking about, and through your podcasts, we are able to reach the patients and the masses. This is the change we want to bring about, where we know we're only helping the patients. There is no
Right.
denying the fact. There is
It's not like some
only good.
magical money scheme you guys are trying to pull together here,
Right,
you
right,
know?
right. Like I said, I would be making three times as much. I'll tell you with confidence, Paul, I would be driving a Bugatti for the amount of money that I've lost. And I say this with honor and integrity. Again, this is just to translate into numbers. We're looking at a lot of money.
Oh yeah.
But the bottom line here is we have to do the right thing. Do unto others what you want done to yourself, and do no harm. This is the bottom line. Why do you want to put something in that is only going to last 10, 15 years? And in those 10, 15 years can cause cancer, breast implant illness symptoms, plus the contracture infection and all these other problems that I highlighted earlier.
Yeah, it is so wild to me. I am not surprised that there's only 7 of you. Because just like you said, you'd be driving a Bugatti, and anyone that's seen the show Nip Tuck, everyone would love to be driving a Ferrari, and they're living this Hollywood lifestyle, like you see on many of the TV shows. Um, are there? Is there a conference? I'm sure there's plastic surgery conferences, just like there's conferences for all the medical field and all these other fields. Are you ever? I mean, I'm sure you're not invited to come to those. But is there a panel that you guys could have and say, hey, the world's biggest plastic surgery conference is such and such. Why don't we at least get out there and have a Q&A? I'm not saying you guys in general, but
That's a good point. Now, I will tell you the ASPS is the honorable society that's discussing. They have
okay.
allowed breast implant illness advocates to come in and discuss. They have raised funds for B.I.I. They have discussed, like Dr. Feng, for example, has presented her data. This is, again, slowly coming about. Now, you would think this would be brought out and
Oh yeah.
action would be taken tomorrow.
Mm-hmm.
Now, I will tell you, there's a lot of politics slash bureaucracy. There's a lot of lobbying by the manufacturers, right?
Of course.
There's so much. Look, the Juul cigarettes, right? Everyone's smoking them. We all know they cause badness to the teenagers who are smoking.
Right.
The narco industry, right? The narcotic industry, billions of dollars. Look, it's been. I will tell you, I run into docs and they're like writing 60 tablets of Norco right and left with one refill. That's wrong. I seen this early on, as when I was a med student. And
Horrible.
these are secret. I mean, you have to protect, and you would think that the administration, i.e., the Department of Health and the FDA, would have put a halt to this 20 years ago, right? Because
Negative.
now look at how many opioids have been abused, like by millions, right? Now, it will translate to, because you know what, at the end, the truth will prevail. There will be no denying the fact. And, the women are talking. As you have heard me say this, I'll say this. You have the manufacturers. They literally are like politically being correct, and they're saying, "Hey, we're showing the warnings that the FDA is telling us."
Mm-hmm.
They're laughing themselves to the bank, each one of them. You got the private, i.e., the when I use the word, the doctors, the hospital doctors, the physicians, the primary care doctors. They're basically very, what's the word to use, passive and naive, and saying, well, these are implants that are safe. Now, remember, this is not their area of expertise, implants. Just like if you ask me to read an echo, heart
Sure.
ultrasound,
Echocardiogram, yeah.
sorry, I'm just like you, Paul. I'm not going to be able to read. I'm being serious. I'm not a cardiologist, thank God. And I could never do cardiology if you ask me. I am, for me, very early on, I knew I wanted to be a surgeon, for example, hands on.
Right.
Cardiologist is a very smart, creative doc in his own mind, but he has no concept of surgery, if you ask me, with all due respect, or I don't have any concept of taking care of a 1 month old or a neonate, right?
Of course.
In a neonatal ICU, for example, or a NICU. Now, going back to the point, the administrative societies, they're slowly, passively, very politically correct with the right input. Look at the FDA warnings here and there. You would think they would jump up and say, hey, you know what? This causes cancer. This causes
Oh.
cancer. They would jump up and say, you know what? Just like they did in 1992, put a ban on not only silicone, but saline. Now you have the patients themselves. They themselves are talking to each other and they're saying, you know what?
Of
My
course.
doctor said, right now I say this to you. If I get your neighbor and lady with the breast implant, and she goes to the top 100 hospitals, the top 1,000 plastic surgeons in the country. 990 of them, if not all 1,000 of them, will say we'll take this set out that's 12 years old and we'll put a
What
brand
a
new
new.
in 2022 or a 2023 version in, because these are your gummy bears safe. Absolutely wrong information, despite the FDA warning, despite the manufacturers. And this is what we need to change. We're trying to change. And this is where the ladies are talking to each other in the masses through social media primarily. If we didn't have the internet, you and I would not be talking.
Oh, no
No
way.
one, none of the ladies would have known about this, none of the Instagram posts and whatnot else, and this would not be occurring. This is now the ladies talking to each other and getting that wealth of information and the data and that confidence that yes, it is very appropriate to proceed with surgery. I have so many patients that come to me, they say I want to proceed, but my significant other is saying that this is not a good idea because his close friend is a friend of a plastic surgeon who said implants are safe. Now I say I don't blame him, because look, if the plastic surgeon is saying these are safe, who's telling you to remove something where you invested, back when you got the augmentation so much? Now I'll tell you, just listen to what I said and listen to the ladies. Don't listen to me. Listen to the
Right.
FDA. Listen to the manufacturer, the mentor or the allergen disclosures that they have reported. And then, most importantly, listen to the ladies. You will only be, I use the word, shocked to see how real this problem is and how real the solution is. So I invite everyone, go to the Facebook group posts, for example, go to the breast implant illness support group by Kahn, for example, my, and the many others, and you will see for your own self. Make a real effort to study, to evaluate, talk to the plastic surgeon directly, preferably look him in the eye. And you want to get that confidence that you are talking to a surgeon who really believes and who will do the right surgery, which is, again, I cannot emphasize this enough, an end block or 100% total capsulectomy and getting everything done. Now, I
I feel like it's funny because that comment you made about the husband, I feel kind of like for lack of a better word, a shitty asshole husband, because in the beginning I was kind of doubting. I was like, yeah, maybe. But just like Dr. Kahn said, I urge any of the wonderful women out there that have gotten the surgery, gotten a breast augmentation before, and I'm sure there's some attachment to that. For some women, I don't want to speak for everyone, but I got to think that there's some physical cosmetic attachment to that. So I'm sure some women are probably scared. What will I look like? Will people still like me? All these, I'm sure, other mental factors roll into making this decision. But man, I definitely will be 1,000% supportive for my wife getting it done. She's probably going to listen to this and go, "All right," uh,
No,
but
I will tell you, I don't blame you. I don't blame your wife. Remember when she got it, or any other person. Remember, if let's say right now, I take my neighbor, and she
mhm,
says I have breast cancer and I want to get a mastectomy, they will inevitably quote declare implants are safe. You will get the implants, and the system tells you it's safe. So you have no one to blame but the system. If I
right.
go in and say buy this cell phone that would blow up and catch on fire, right? And the
Shout out to Samsung.
yeah, and I had that phone, and there was only, I think, reported 21 fires that I know of,
Right.
and because of 21 fires, there was like every plane that I got into, they're like, if you have a Samsung, you cannot fly. And I had to give that phone up, obviously, very early on. And it was just
Mhm.
21 phones. Now you have looking at, there is reports of 1.8 million patients, at least in 2018, who got implants all over the world, because this is not an America problem. This is a South America
Worldwide.
problem, European problem. You have the rest of the world also getting implants. And to date, there are approximately, and again, these are estimates, almost 30 million people who have implants or who've had implants over the years. So these are a lot of patients who are hurting, and not only them, but their significant others.
Wow.
their neighbors, their work, force, for example, and everything around. And these are, and if you can imagine 1.8 and over the years, how many implants have been inserted. And the point I'm trying to make here is there are a lot of people who need to read up and educate themselves on what is breast implant illness. And most importantly, again, like I said, just listen to the patients who have explanted successfully, and when done right, you will see that they're only happy and satisfied mentally, and they are also relieved of the fact that they're not going to be looking into a rupture next year. Look, I
Sure.
told you this mentor itself said that if you have implants, this is the manufacturer themselves saying, if you have implants at year 3 into your augmentation, and then every 2 years onward, you should look for a silent rupture. You, I did a case yesterday. MRI said rupture on the right, rupture on the left. So I went into the case. This is an explant that I did. Nice
Mhm.
lady. And lo and behold, the MRI was wrong in both of the cases. So it was not a rupture to the patient's gut and my gut, and the implant was very much intact. And the point here is, even the MRI, which is supposed to be the best test, which is an MRI without contrast of
Right.
the breast looking for rupture, it can still be wrong. And the point I'm trying to make here is, you don't want to be waiting for the rupture. You want to take care of the badness. You want to take care of a small fire versus a big fire, if you
Of
will.
course. People do it with their teeth all the time. I'm a prime candidate of that. They're like, oh, tooth kind of hurts. I'll just wait, and then the filling falls out, and then there feels like their brain is melting, and they're like, oh my god, I should have got that fixed. I think it falls into the same lines. How many explants have you done?
So on average, so this is no, it is very, I was telling someone last night, I cannot imagine in my wildest dreams that I would be doing explants primarily. This is all what I do. 99% of my practice for, plastic surgery has 3,000 operations, and I used to do all sorts of reconstruction. And So my practice is now primarily is confined to what is explantation. So on average, I do three on Tuesday, three or two on Wednesday, and possibly two or three on Thursday, depending on the length, depending on the patient is
Damn.
a cancer patient, if they have flaps. And sometimes I do surgeries on Monday at the hospital. This is like once every month or every 6 weeks. And this is all what I'm doing. So if you do the math, they're looking at approximately 350 to 400 of these in a year.
Wow.
Now, there are patients where I do just one-sided, for example, because they had a mastectomy on one side and they chose to do. So there are variations,
Gotcha.
and I myself am limited by so many that I can do. This is a surgery where, someone told me, you're so busy, you should go ahead and hire another surgeon. I'll tell you, I would not be able to. Um, I use the word with confidence, rely on someone being able to do a surgery where, if I ask 100 plastic surgeons to do an explant, especially dissecting off of the rib, I will tell you 90 of them, 90 of them, will feel uncomfortable dissecting directly on top of the rib because of the intensity of the surgery.
Wow.
Yep.
How is man, I lost my train of thought there for a second. Um What is there an option C, or are they even investigating an option C? So option A, leave them in. Option B, get them out. Option C, why haven't they, with all the technology in the world? It's funny because I asked my wife, I'm like, well, why don't they just create? Why can't they just inject them like they do? Girls are getting the Brazilian butt lift things and all that kind of business going on. And I asked my wife, and while I'm talking about my wife, I would like to give a medical shout out to all of the people in the medical field. Dr. Kahn, you brought up, how hard it is in the hospital and money and all that. I appreciate the sacrifice and service of every single person in the medical field. Hands down. I'm a former Navy guy for 10 years. And, people tell me all the time, thank you for your service, this and that. I would like to, thank all the nurses and doctors out there. Thank you for your service, not just during COVID, but in general in life. They are all extremely important and needed. And I appreciate what you are doing,
No,
Because
no,
I'm
thank you,
sure.
thank you, thank you. No, it means a lot. No, it's not easy. I'll tell you, this is, if you ask me, I lost my youth to study, and I say this
Hmm.
very bluntly. When from undergrad, getting into medical school, and even in med school, my goal was to achieve the best even in general surgery. Your training, you're looking at, back then the hours were 80 to 88 hours, but if you look at the hours, we still worked 100 to 120, because when we came home we had to still study. You couldn't do anything. You had 2 weeks off a year. This is, you're looking at 10, the youth, the 20s, the 30s, and even nowadays, it's like a 24/7 thing, if you ask me, because this is, you know the easiest part, if you ask me, is the surgery itself. The hardest part is prepping the patient, making sure the patient meets criteria for surgery, that the patient's not going to have any heart issues or any lung
Right.
issues, especially when all these patients are coming from out of town. So it is a continuum. It is not like a part-time where I can do this. It definitely consumes the doc. And really, from the nursing staff, which really works tirelessly at the hospital, even my team, to the respiratory therapist, physical therapist, the entire medical, it is a very emotionally and physically draining, where it consumes you. But this is extremely rewarding too, where it really, when a patient looks at you in the eye and says thank you like you did, it means
Right.
a lot. This is what drives us. And this is where we're programmed. And I will tell you, just like if you have a good cook, and he cooks from his heart and goes to the person who's eating and ask if you enjoyed the food and you felt good that they enjoyed, or even someone who's cutting the hair, that they have pride in their work. One has to have pride in whatever they do, because that's what makes them excellent, right?
Right.
We're not looking at good, we're looking at stellar. Do the 100% from your heart. There is no other interest except for the best for the patient. There is no other second motive here. Now, this is going back, and I appreciate your your feedback, your remarks. It is important to acknowledge, and I'm blessed to have a very nice uh, practice where I have full confidence in my patients, and the patients have confidence in me, where they
Right.
sign up for the surgery even without talking to me, which is huge for me. And
That's wild.
I want to give them 100%, so that they get the 100% out of me and my practice, so that when they do go back to their lives, they're free of this silicon toxicity. And hopefully this translates into a good and a better and a longer quality of life, if you will, such that they're free of what is a man-made problem, if you will. Now, one thing I want to highlight here is, if you, and this is what I stressed earlier, if you go to 10 different explant surgeons, you're going to get 10 different answers. And this
Right.
is what I find very interesting. What you were saying, is there a consensus or a board or a governing body that looks at it and say, what, this is the standard, this is what needs to be done? Now, I will tell you, for me, I've done so many of these where I say, what, I learned from my experiences as a general surgeon and as a plastic surgeon. And I said, um, I, I find that these are the ways I do it, and I have a track record, and my patients will attest. And when you go to my Facebook support group page, you will see this reaffirmed over and over again. Number one, the implants are always returned to the patient. Number two, the cultures are sent for microbiology, aerobic, anaerobic, and fungal. Number three, the capsules are always sent to pathology to rule out the B.I.I, squamous cell pathology, breast cancer. There was a patient like almost 2 months ago that I did. She had history of breast cancer, and they found breast cancer and the mastectomy scar. So everything that is removed must be sent. Number
Jesus.
four, twilight anesthesia, which is basically, you have the general anesthesia where the patient's paralyzed and the machine is breathing through the ventilator is breathing for the patient. This is still relatively safe, but what is even safer, I find, and more practical, comfortable, and effective is the twilight, where the patient is sedated and deep sedation. They have no recollection to date. Not a single patient has had any recollection of the surgery itself, and they're essentially breathing on their own. Sometimes they're on the tube that we've been put in because of reflux, and every patient is, very carefully selected for the appropriate what is twilight anesthesia, and vast majority of the cases are done in this fashion.
Hmm.
I have not used drains in the last almost 3 years of my practice of having explanted. I've been explanting literally nonstop, and the surgery can absolutely be done with a essentially minimal blood loss, maybe 3 to 5 cc's on 97, 98, 99% of my patients. And then the next thing is I don't do the lift in the vast majority of the patients. Now I've started to remove what is excess skin at the bottom, and kind of like a Nike check sign removal of the skin, such that it kind of gives a pseudo lift once the implant is removed, especially when the implant is bottoming out and lateralizing. Lateralizing meaning it falls down and outward. So it helps with that excess skin. And this is where the patients I have done repeatedly. 20 years from now, I cannot imagine any of this being done any different, because
Hmm.
you're doing a complete analysis of the capsule. The cultures are being sent, fungal infections, among others, are being rolled out. The implants are being returned, twilight anesthesia. And the whole focus and gist of the surgery is to remove the capsule and the implant plus all inflamed tissue. And there is no other vested interest. And in the vast majority of the patients, 80%, they are not candidates. They did not need a lift. And this is where I find that this is going to be hopefully translated into what would be very effective explantation, both saline and silicone implants, so that the patients post-operatively have that complete feedback from the pathology, microbiology, and the surgery, that everything went great and smooth, and that there is nothing inflammatory remaining behind, like the residual capsule, for example.
Uh, all really fascinating stuff for a topic that I really knew nothing about. Now I'm getting like the master class in um, explants and how bad breast implants are. Uh, Back to what I was asking, I got sidetracked. Giving a shout out to the medical field. Are they developing an option C, a new form of implant that's actually 100% safe? I got to think that they're only going to swipe it under the carpet for so long before 10,000 women with breast implants kind of go, hey, hello, you kind of told us that this was bad, but you didn't say it was going to be this bad. So why haven't you come up, not you, Dr. Kahn, but why hasn't these manufacturers said, okay, we have the capability to develop something just like the Brazilian butt lift thing, the injections in the butt. Um, and back to what I was asking my wife, she goes, well, you can't inject someone's breast because of all the health complications that it's a lot, your chest is a lot different than your fat butt.
So this is the fat injections that I was telling you about,
Oh,
where
okay.
50% of the fat is going to die, and the clumps of fat necrosis might result as
Just
a direct result. So this is, now I will tell you. So again, as a board certified plastic surgeon, fact: the Brazilian butt lift, which basically means in plain
that's the
English,
injection, right?
yeah.
To be clear.
So
Okay.
in plain English means that the fat is harvested again from usually the abdomen, the belly, or the thighs, right? And it is then injected into the buttock area in order to enhance or add volume to the buttock area. This used to be and is one of the most dangerous operations done by plastic surgeons, to the point where the plastic surgeons and the different societies grouped together, and they came up with a consensus and the criteria as to decrease the chances of risk. Because what was happening was a lot of young ladies literally
Yeah.
were dying, and this was the most dangerous operation done by the plastic surgeons.
That's crazy.
And I will say this, and I'll say this very definitively. Now they've reduced it, and they have said that this is equivalent now to getting a tummy tuck. I will tell you still, as a board certified plastic surgeon, because the amount of fat that is being injected, the Brazilian butt lift is a dangerous operation. Any professional, honorable, ethical, good plastic surgeon should not do it.
Dang.
Period.
I'm gonna get some
I,
hate mail, I think,
no,
from
no, no.
this.
I'll tell you, I'm going to get a lot of hate mail, but I'll tell you this. I want each one of you to, who is ever listening, I'm not making a exaggerated statement. this is still replete. Now they said deposit the fat directly on top of the fascia. I'll tell you, there's still a lot of plastic surgeons who are diffusely doing it, and now that fat can basically go into the vascular system and then embolize, which means travel to the heart, i.e., the lungs, and then cause what would be fat emboli syndrome or fat emboli, which means that the fat now basically travels in the bloodstream and will lead to problems. I want each one of you to Google, and again, there will be a lot of information that you'll be able to get the safety and effectiveness of breast implants, excuse me, and then the safety and effectiveness of the Brazilian butt lift. And I will say this with confidence that you will get the same decision as a 20-year-old, 30-year-old. You don't want to be doing a surgery where there's risk of death and there's accepted risk of death. Now, this is not like you're going to have an infection or, patients have reported a significant number with loss of sensation, asymmetry, which is true for any fat grafting, right? Now, this is what I was saying earlier, that you should not. The breast area or the buttock area. And I want each one of you, including Paul, you can look it up. You can go to the different societies where they were alarmed by the number of non-board certified plastic surgeons who are doing this procedure as well. And there is a very high complication rate. And remember, I said this was the worst of all the procedures, of the 3,000 or so plastic surgery procedures, because this was the number one cause of death. Yes, they have decreased that, but still it is up there as far as complication of not only infection and hematoma, seroma, loss of sensation, irregularity, asymmetry, but death. We're talking about the demise, i.e., death of young 20, 30-year-old. You don't want to be doing something elective that will ultimately lead to this. Yes, the
Right.
numbers have gone down significantly, but this is still not down to where I would say it's acceptable.
Acceptable.
Yeah.
That is crazy. I didn't even think we were going to go down that rabbit hole about the butt lift thing. I thought that was good to go. I'm here like, okay, option C, just do the Brazilian butt thing, but for the boobs, but can't do that. So have you heard of any studies of them trying to create an option C? Because I'm sure they're going to want to keep this gravy train rolling,
Right.
correct?
I will tell you, a friend of mine, asked me, so what's the option? I say, number one, do no harm. If you have breast cancer, doesn't mean you put in implants because you have no other safer alternative. Now, there are deep flaps, which means the deep inferior epigastric flap, which basically means using the patient's own native tissue, sometimes taking the fat from the belly and then transferring it up, or a latissimus flap, or a gluteal flap. Again, the patient's own native. Now, these are long, lengthy uh, procedures where it's the microsurgery aspect of breast reconstruction, where the patient's own tissue is used and the vessels are connected, including the artery and the vein, such that there are long-term permanent results. But these surgeries can be anywhere from 8 to 12, 18, 20 hours. Again,
Oh,
but when they do work, they work beautifully. But I will tell you,
18
uh,
hours?
yeah. No, I once was involved in a microsurgery procedure when I was in training for almost 24 hours. And,
Oh
this is,
my God.
yeah, there was another surgery. And again, if you ask the now, this is not always the norm, but
Sure.
this has led to, it's not uncommon. If you're doing plan A, plan B, then you basically try to, but this is not uncommon, where 16-hour, 18-hour micro reconstructions of the breast are done. Now, on the norm,
Wow.
there are groups that do it routinely, safely, very wisely. And I have to say, it's a very reasonable option. And you have to select the patient reasonably, and the patient has to be healthy. You don't want to be on the OR table for an extended period of time. Remember, I gave you the 6-hour rule
Correct.
on general for what is elective surgery. And, what I would recommend is, for those patients who seek reconstruction, especially after breast cancer, with a board certified, reputable ASPS microsurgeon who can reconstruct, and they understand in their individual unique case what is a reasonable reconstruction option, and in a good microsurgeon who does these on a routine basis, 2 a week at least, you're going to be in, I use the word, safe hands to do what is a very viable, reasonable option. If you ask me, and again, I'm like the minimalist, I don't want to do anything that may potentially even risk me for even a second. I'm just like that, I will
Right.
never get a facelift in my life. I'll never get Botox in my life. I'll tell you, I can go call 500 of my plastic surgery friends. I don't have 500, but anyone, but
I was
any,
like, damn, you got a lot of friends.
yeah, yeah, yeah. But we run into each other. We know each
Of
other.
course.
There's 8,000 of us, by the way, in the entire world. So there's not that many.
Yeah,
Every
that's
year,
a small family.
they're very small. So every year, on average, believe it or not, there's 200 of us who get board certified. So it's not a big list, but we know each other from the conferences. I will never do something where I want to have wrinkles. I want to have the gray hair. I want to age with grace, if you will. That's
Same.
who I am. My goal of life is the same as yours, Paul. Is the same as your wife, as a neighbor, is to live to 120 without a single trip to the doctor. No, I'm going to get screened for colon cancer. I'm going to get screened for the 1, 2, 3. I'm going to listen to my doctor, but I don't want to do anything unnecessary that will hurt me, right? And hence, this is my take on. Again, what is, like, going back to, for example, the Brazilian butt lift. It's not as simple as, sure, he told me his rates are minimal, complication rates. No, it is still very, very high, if you ask me. Certainly much more reasonable than what it used to be after the consensus by the societies of plastic surgery, but it's still up there when it comes to the complications of what is a elective procedure uh,
Right.
that is replete with problems.
Man, so much to take in. I guess in closing, I want to ask you before I let you go, what would be your biggest and best advice to give any woman, if they are listening to this for the first time, they're kind of, they've had breast implants for a while and they're, just in a huge, massive question mark. What would be your advice
That's a very
to
good
anyone?
question. And that's going to be a very good question. I'll give you the answer that my patient today, when I did the explant, she said, I've been studying you for 2 years.
Damn.
So yeah, she's like, I've seen every video of yours, and I post a lot from Facebook Live from the operating room. I like these discussions, for example. Talk to the patients. The patients have nothing to gain except for your good health. This is to the next lady who's listening who has implants. Let's say your wife, your neighbor, any patient, and the significant others, the husbands, the boyfriends, you know, the well wishers. I had a patient that went to a notable big hospital, and she's like, my whole family is saying you're gonna leave that top 5 institution and go to someone in Michigan
Hmm.
who's not many gray hair, who is going to do this explant surgery. And she said, I know what he's doing. And this is where that confidence comes in. This is where I want each one of you to review whatever I said. I put my reputation on the line when I spoke against the Brazilian butt lift. I could have chosen not to, right?
Sure.
I have never done one. And I'll tell you, I know enough to say this with confidence as a board certified plastic surgeon. And you ask any reputable plastic surgeon, they'll tell you the risks that are present. So I tell the ladies, go on a listening tour to the husbands, to the brothers, the sisters, the moms, right? I had a patient, she's a grandma. She's like, my 3 daughters said, you cannot do this. And she's like, who are you to tell me this is my life? I'm going to take it upon me. Now, this is where you join and you say, you know what? Don't make a decision. Don't make a decision about what I said today. Listen to what I said, process it, analyze it, apply it, listen to the patients. You will
Research.
hear, yeah, research. Here, after some time, you will be convinced without a doubt that this is in your heart the right decision, a no brainer decision, and a decision where if you just listen to what I just said, listened and verified what the FDA has said, the manufacturers have said, the patients have said after they have explanted, you will only be convinced this is the best decision for you. And you will see ultimately, look at the trend. You have the celebrities that are coming forth now, the many patients in the masses, and you will yourself be in that confidence zone where you're going to say to yourself, this is exactly why I'm hurting, why all those tests that are negative because this is breast implant illness, because there is no true test or exam out there that will tell you with confidence. And time will be only witness to the fact that once the implants are removed right and properly, that you will only bounce back to a normal state of good health minus these toxins.
Well, that was amazingly well said, and I guess I'd like to urge anyone, any woman for that matter, if you do come across this new podcast, where can they find you? I have the ticker running on the bottom, executiveplasticsurgery.com. You're on Facebook, you said?
Yeah, so go to my, so because of the patient's privacies, for example, I don't want to do a general because there are a lot of ladies discussing personal input, so join, we screen everyone, we let everyone, but we want to make sure that, we protect the privacy of the ladies. They actually encourage to have new members come in. The Breast Implant Illness Support Group by Dr. Kahn. Join my group, join other groups, because remember, you want to have an open mind. Talk to plastic surgeons. You want to talk to not their PA, not their nurse practitioner, not their team. Talk to the surgeon directly. Do not talk to anyone else. If they're not, oh, he's too busy. No, he cannot be too busy for you, because the worst thing in all of this is to get to surgery and then realize, oh my God, I made a mistake because I chose a surgeon who is nice, genuine, professional, but he's only done 2 of these last year or last month. And now the capsule's left behind, and now you have that task to go back and removing the residual capsule. You want
Right.
to do the right decision. You want to have that level of excitement, confidence that you have the right surgeon. Talk to the other surgeons as well, 3 at least, I would say, so that you have confidence in the one who's going to do the right surgery, and the other 2 will convince you, and you will learn from each consultation about what is the right thing to do. And especially if you go to the Facebook lives, listen to the patient, the private breast implant illness support group by Kahn and the many others, and you want to make a reasonable decision. Sometimes it's easy to talk to someone and the 2 of you or the 3 of you or the husband, wife, or the 2 best friends now navigate this path, and it may take 3 years, it may take 3 months, whatever length of time, so that you make a sound decision and you feel confident and comfortable. Your sixth sense tells you you're doing the right thing, and you will know from your heart. I promise you, you will know.
Well, that's, I couldn't have said it better myself. With that being said, Dr. Kahn, I'd like to thank you again for hopping on the TastyBrains podcast. Everyone out there, do a quick Google search, breast implant illness. I'm going to bet Dr. Kahn's name comes up because that's exactly how I found him. I did my little research on him, and as you can tell from almost the 2 hours we've been talking, he knows his stuff. And I've refrained from swearing on this podcast pretty good, I got to say, for myself.
Mhm.
I was trying to be as professional as possible. And once again, I thank you very much. I know it ain't easy being, the one guy on the hill preaching your cause. And I'm sure there's, if there's how many thousand plastic surgeons?
There are a total of, if you go to the society itself, there are a total of 8,000 plastic surgeons who are board certified by ASPS.
So 7,999 are staring at Dr. Kahn going, hey, man, don't take my Lamborghini away from me. I'm sure I'm sure it's going to get more uncomfortable as time goes on, but there's a lot of ladies, as you've already told me, and that my wife has shown me in certain groups, that can attest and appreciate your hard work and that you're trying to bring it to the forefront. So anyone that does listen to this, feel free to drop a comment. Fact check Dr. Kahn all you want. Throw them down in the comments, and I will take a screenshot and send it to him, or I'll just have him reply direct. So yes, like, comment, subscribe, Tasty Brains podcast, and that is episode 5. I appreciate everyone again. Have a great night. Thank you.
You're welcome.